find out where the cancer is, and we'll take care of you.
Yeah. Okay, I think that's what I'd rather do. I should have done it before 2 years ago.
All right, well, it's better now than never. So come in this week. Let me meet you. Let's go over all the details, and let's try to get you fixed up, okay?
Okay, will do. Thank you.
Thank you
very much, sir.
Call the same number during the week, and God bless you.
Thank you.
Bye now. Okay, so back to this Irish-American man with the prostate cancer I treated 15 years ago, high risk, incomplete remission, the cancer of the ear. And when I speak to patients, part of that time that we sit down and spend some time, I ask questions. And then he came up, and in response to my questions, he told me he had a cancer in the kidney with metastasis to the lung, diagnosed last year. So now he's got the prostate cancer in remission, the skin cancer that the surgeons were going to cut off his ear and his face, and now a kidney cancer that spread to the lung. And he tells me that the doctors told him it's not changing. Well, what does a cancer do? The job of a cancer is to grow and spread and take your life. That's what a cancer wants to do. So I called up the head of radiology at the facility where he had it, and I said, look, this man had kidney cancer and lung metastasis, and he's telling me you guys told him it was unchanged. And the head of radiology said, look, that's not what's there. And I asked him, please measure the kidney cancer, please measure the lung cancer. And both were enlarged by 30% in 1 year. And I told the patient, and the patient heard me on the phone, speakerphone, with the radiologist, that the kidney cancer is growing, the lung cancer is growing, and the patient knows that the cancer on the skin and the ear is growing. So I believe we can help him a lot. I believe we can help him keep his face, keep his ear. Our success rate's over 90% for skin cancers. And we've treated a lot of massive tumors. You remember that patient last year we talked about who was going on to hospice? She actually was in a hospice hospital waiting to die. And a friend of mine, a dermatologist, remembered Dr. Lederman and gave my name to the patient's family. They took her out of hospice hospital waiting for die. She had radiosurgery to the face, 5 treatments, and she's back home in remission. Unbelievable. So can we help people? Yes. Can we help everybody? No. There's never an always or a never in medicine. This man, prostate cancer in remission, fantastic. The skin cancer he wants to go ahead with. For some reason he wants to wait on the kidney and the lung metastasis. Lung metastasis means the cancer is spread from the kidney to the lung. He's more concerned about the skin because he can see it and it's bleeding than the kidney, which he can't see, but that's growing too. I hope he has the wisdom to get all 3 treated, because it's sad to look at someone that you know you can help, most likely can help, and they just don't want the help. So for this man, we wish him well. He has 6 children. Happy Father's Day. We are going to see him this week to start the treatment on the skin cancer. We're going to hear a word from our sponsor, Radiosurgery New York. And again, you can call us for the information if you wish. We're at 38th and Broadway. Our address is 1384 Broadway. We're a private cancer center taking most insurances, Medicare, Medicaid, there to serve you. Here's the man with the golden voice.
Here's Dr. Gil Lederman, New York's only Harvard-trained, triple-board-certified radiation cancer doctor. If chemosurgery or radiation isn't working or isn't tolerated, when cancer and its pain and symptoms aren't getting better, seek a fresh second opinion at Radiosurgery New York's Urgent Cancer Consultants for innovative, custom-tailored cancer treatment. See our experts within 1 business day, because we know your time and your life are precious. Our goal is proper diagnosis and effective, non-invasive outpatient treatment. Decades of leadership, first in New York with brain radiosurgery, first in America with body radiosurgery for cancers of the brain, body, and prostate, all custom tailored for you. Call 212-CHOICES, 212-CHOICES for a prompt appointment and free booklet DVD. Super convenient, 38th and Broadway, with most insurances, Medicare, Medicaid accepted. You're next at Radiosurgery New York. Just call 212-CHOICES, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
We're back, and I just want to talk about two Harvard doctors who wrote in the New York Times an article entitled A Cancer Treatment in Your Medicine Cabinet by Michelle Holmes and Wendy Chang. They're writing about the possibilities of benefit from aspirin for women who took aspirin that had breast cancer. In 2010, they wrote, we published a study in the Journal of Clinical Oncology showing that women with breast cancer who took aspirin once a week for various reasons were 50% less likely to die of breast cancer. In 2012, they wrote, British researchers looked at results from clinical studies that showed that aspirin to treat heart disease also found aspirin was associated with a lower risk of breast cancer death. And they write, until now, there's been no randomized studies of aspirin for women with breast cancer. Why? Well, because pharmaceutical companies can't make billions of dollars from an aspirin that you can go to Costco and buy 1,000 pills for $2. So they proposed a randomized study, and there's now a randomized study, which means half people get it, half people don't get it. A randomized study in Britain for aspirin for women with breast cancer, actually in 4 cancers. Unfortunately, this study won't be done until the year 2025, so we're all going to have a little bit more gray hair by then. These two women are asking to please get a study going on in America to look at the possible benefits of aspirin. I don't want you to all go out and take this aspirin for breast cancer. It's not the recommended treatment. We don't even know if it's confirmed. There's never been a randomized study. Aspirin was derived from the willow bark, which has been used since the time of Hippocrates as a painkiller. We don't know why it supposedly works. If it does work, aspirin reduces inflammation. It may inhibit the growth of tumors, possibly by preventing new blood vessels. We just don't know. It should be studied. These two women are asking to please study aspirin and why it appears that some women with breast cancer benefit with a reduction of cancer death in the women who take aspirin for other reasons. Also, obviously, it's cheap, it's easy. It might be a way of treating people around the world, a cheap, easy treatment. Isn't that what we all want? So I'll report back to you on aspirin as the studies go on. There's another article that was in this week, like the OIV department. The Aetna CEO says Obamacare rates increased less than 20% in 2015. I thought we were told that we weren't going to spend an extra dime and we're going to keep all our doctors. If you like your doctors, you could keep your doctor. And Obamacare wouldn't cost us wouldn't cost us a dime more. Didn't he say that? A dime more? This is an article from Reuters, and the headline is Health Insurer Aetna is submitting premium rates to regulators for 2015 Obamacare insurance that generally increases rates less than 20% more than 2014. Wow. That's all we need is 20% more health care rates. It's been 20% more, I think, for the last 5 years. And now I want to talk to you about a patient who came in, a very skeptical woman and her husband and her very skeptical daughter came in late Friday. She's 77 years old, married, and she had adenocarcinoma of the distal esophagus going into the stomach. She had radiation at a highfalutin cancer center last year. She's had no recent staging. no treatment. She's been left in pain with this cancer causing pain. She's been left losing 80 pounds. Her weight dropped from 250 down to 170 pounds. No one's talked to her about treatment. No one's talked to her about staging. She was told circuitously that the cancer has entered the liver. Wow. Can you imagine that? Being at a cancer center, just being put on narcotics which don't work, cause her bowels to not function. She's been constipated. If she's lucky, she has a bowel movement once every 4 days. So she came in Friday. Her husband heard us on the radio. Maybe he's listening this morning. I hope he is. And he can confirm everything I've told you is true. So we offered to stage her. I offered actually Friday to get her staged, fully evaluated the same day. She preferred to come back on Tuesday, so she's coming on Tuesday to get staged up, to find where the cancer is, why it's causing so much pain, why it's causing her so much weight loss, why she's staying at this hospital that's just watching her. Her husband said, well, he goes there, they just give him a death sentence. So I don't know why they're going for no treatment. This doesn't make sense to me, being left in pain and suffering. Of course, that's an option. Every patient has the right to that. But she came to us because I think she wants to have new choices and new rights. And her rights are she has a chance to get out of pain and suffering, see where the cancer is, find out where it is, what it's doing, and hopefully get treatment that's going to make her better. And from the good news department, this is a woman from South America, wonderful woman. She's about 60 years old. She has metastatic gynecologic cancer. So she has cancer that started in her ovaries and gynecologic structures. She's called a mixed Mullerian tumor. It's a cancer. She's stage 4. We met by accident. She was walking around Manhattan. She said, I want to find Dr. Lederman. And a Spanish man said, that's Dr. Lederman over there. I happened to be at that place where she was asking, I want to see Dr. Lederman. I just happened to be there. And we met. She's had treatment. So this is a woman, she has systemic disease, so-called systemic disease. When you go see the chemo guy, and they say, oh, you have systemic disease, you need chemo. She doesn't want chemo. She's had chemo. She hates chemo. So she has a cancer. If she has a nodule, we treat her. And if she doesn't, she stays home. All her life is quality time. She's had no downtime from radiosurgery. She's had no hair loss, no nausea, no suffering, no transfusions. No. She lives her life. She goes to South America about 3-4 months a year, then comes back. We stage her up. We find her where the cancer is. If there's cancer, we hit it, radio zapping. If there's no cancer, there's no cancer, and she comes back in another 3 months. So rather than years and years and years of chemotherapy, we just hit the cancer, and she has a high-quality life. And she's so happy. And every time I say, do you want chemo? Because the chemo guys want to give you chemo. She said, no, I don't want chemo. I want my life. I want my life. I want my quality of life. Dr. Lederman, I want you treating me, and that is it. And that's what she has. And it's her right. It's your right. It's everyone's right. You are the president of the United States, of your body. And we're going to hear from some voices. If you want the booklets DVD, call us during the week, Monday through Friday. We'll send you the booklet and the DVD about the work we do. If you have medical questions, call us day or night, 24/7 at 212-CHOICES. Medical questions, we're there for you. Not a machine, not a student, not a secretary. Medical questions, call us at 212-CHOICES, 212-CHOICES, where a private cancer center takes care of you, not run by the drug companies or the surgeons or other. We're here for you. So now a word from our sponsor. Here he is.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. With Dr. Lederman, the radiosurgery pioneer, that's our goal too. He's first in America, first in New York, first for you. With Body Radiosurgery, we hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with